vacancy savings.
Okay, but so what if we just say for now, I mean, just conservatively speaking, we say that EHEB is going to provide $50,000
I think
and
that's, yeah.
and that what we need to do to plan for the April application, the April 2024 application, is that we need to start approaching different programs. And Arian Coronado is here from Public Health Division, and I'm not suggesting that Arian can speak for the entire division, but I think Arian is a good first start because her group uses IBIS data quite a bit. So I think we would start talking to PhD, and so Arian could hopefully, if you'd be willing to facilitate those conversations on the PhD side, so that we can start to find out how much money could we raise in order to start the this project. And then we would also potentially pull in more people for the planning of it, because a lot of people use it in different ways. So it could also be different agencies. Different agencies wanna, like ECCD, for example, they could potentially contribute funds as well. So there's probably going to be a little bit of coordination regarding that.
And who's going to head that?
So why don't?
Yeah.
Yeah, I get it, Stephanie. So why don't, for now, I will kind of take the lead on that, because you know, I think it's obviously not just EHEB, and I may be able to make more of those connections and initiate the, you know, I can talk with Laura and say, hey, is it okay if I just kind of run with this? And as long as she's okay with it, then I can do that. And that may get us faster along the path potentially.
Okay, thank you. Yeah.
Let me ask a few questions. So you guys have money to kind of keep you guys going until after the legislative session ends. And then after that point of time, how often are you using IBIS thereafter? Is it like 20, you know, is it all year round that you guys are entering data, or is it like in specific timeframes?
Okay. Yeah, and the other thing, Sean, is that people from the public access it all the time.
Yeah, it's a major part of the DOH data communications.
Yeah.
In fact, it is the data communications, and just to let you know what's going on, there are people who are building standalone data dashboards. And what we're going to end up is with a fragmented data system. And
right. So some people are like some programs are saying, okay, hey, we have our web page, and you know, we want to display the data on our web page, which is fine. And they're going to use Power BI or the free version of Power BI, which is fine. But I think it really makes more sense for us to pool resources so that we have a good tool where we can, you know, query, and you could have a link to the page so that you could, you know, show it. So that, I mean, I know people want to have visits to their web page to show CDC or different funders that's actually being used, but it seems like there would be a better use of resources if we can pull them together. So IBIS would have to kind of be there, and then you'd have to have like a background development process, and they would be in parallel, and then you do the beta testing. And then, you know, at some point in time, IBIS would, although I don't know if we can still call it IBIS or what, but then IBIS would go offline, and then we would have the solution that was developed.
So Heidi, you're saying that IBIS, even though right now it is the query platform, would be replaced with another query platform, because data dashboards don't replace the query feature.
That's right. That's
Okay.
right.
And
Right.
I, besides like knowing preferences from IT, that sounds like a kind of a bad exercise, like maybe just IBIS should be sustained.
Well,
Well-
so when you say IBIS, it should be sustained, Arian. There's not going to be any more. So the vendor who is, provides the IBIS platform, that was who provides support for the IBIS platform, STG. They're no longer going to be providing any support for IBIS. And then Data Files is the company that's run by Lois and her husband Paul, and they're basically wanting to retire. So the
Yeah,
NM IBIS
okay.
platform is not going to be feasible going forward. So
Mhm.
we're not making an arbitrary decision just to axe IBIS. So there's that, and then there's also, we need to have a more streamlined platform and something that can work a little bit better for us. So it's a combination of things, but we really don't have the option to continue IBIS.
Oh, okay. Thank you for that clarification.
Absolutely.
Okay.
Heidi, did you guys come to an agreement with Lois and Paul on continuing to provide maintenance and support until we can build another system?
Yes, we have a draft of a contract, and that should have been sent over for assignment as either a IT contract or not.
Right, because it was already deemed, so the scope of work,
Yeah.
Shauna, was already deemed as professional services. And then initially, what Glidden had said is, you need to put it in an it needs to be an IT contract. But he said, it's probably going to be, once it comes to us, we'll probably kick it back because it's small enough. But the process is, and I don't know, Stephanie, has Liza said that she's putting it on like the IT contract format, or is something else
No,
going on?
she said that that IT would put it on the IT contract template.
Okay,
Yeah,
and did
I
she,
spoke with her yesterday, and she said that the template was for some reason logged, and we could not access that. So she sent the template, all the information in an email to Glidden, and Glidden replied saying that he'll have Joseph, I believe.
okay,
I think that's the name. That he'll have a conversation with that person to have that on the template.
okay. And so what I think is, and when was that email? Was that this week or was?
I spoke to Liza yesterday, and that email was dated 12/7.
Okay, so yeah, and so I guess I'd give a couple of days and then I'd follow back with Liza to say, hey, what's the what's the status update on this? And then you can always forward that to me for my awareness.
Okay.
Okay.
Okay, another few questions. So how much is the contract? What's the quote? How much is it for?
59,000.
Okay, one of the things that you guys need to be aware of is that the statewide purchase agreement expired for all IT professional contracts. So right now, we're not doing any contracts at all that are on statewide purchase agreement. And I spoke to,
But they're
You
not
know.
on they're not on the statewide purchase agreement. This is
So
just
then-
small professional services contract is how it would be handled.
you need to talk to ASD to see how they're going to procure it. So I don't
I
know
think
if
we
they're,
already done that. We already got it deemed.
well, so you can get it deemed, right? So that's the template that you're using. That indicates what template you use, but then but how you procure it is something different. So if they're not on the statewide purchase agreement and we're not just using the statewide purchase agreement to get it through, then ASD has to tell us how they're going to, like, if it's under 60,000, you have to get 3 quotes. but you'll need to
Okay.
talk to them about that, because I don't
Yeah.
know for sure, like how
And
they
I
want to
think,
push it through.
yeah, and I think that's why, so Glidden had already talked with Joseph, so I think that's the purpose of the email where Glidden said he was going to talk to Joseph, since Joseph Levada's in ASD. So I think we're waiting on them. I think that's where we're waiting on them, is to say, okay, how are we going to do this?
So can you forward me or add me to the email chain? So that I can get the clarification, I can talk to Glidden and ask him.
Okay, so that would be, I don't know that I'm on that email chain or not, Shri, but if you could follow it, if you could forward it to Shauna.
He must
Just
be
if you
off.
can
Yeah,
reply
I'll
to
do that.
all and just say you're
Okay.
adding me to the conversation.
Might as well copy me too, so I can follow along.
Okay, and then just for my purposes, so Anna and Shauna, what are you both going to have a role in this going forward? It sounds like it, and if so, what is that?
So I need to, so Shauna, me, I need to find the mechanism of what we're gonna do this. So first, I need to know how much money you guys are gonna have. So
We
I
can't
need
tell
to-
you yet.
I need to dedicate resources and find a developer that would be able to do this. So one of the first things that we need to do is have a demo of IBIS to see, everything that's in there. I probably want to meet with Lois and Paul to talk about the backend database. I need an
Mhm.
entity diagram of what data you
Okay.
guys have in the backend.
So,
And then, Mhm.
go ahead. Go ahead.
And then I need to know like what kind of data is stored in there. So is like tell me the data that you guys are collecting. What kind of data is this?
Record level data. So
Of
birth
what?
data, death data,
Birth
birth
data?
data,
Hospitalizations.
hospitalization data, emergency department data, BRFSS survey, population survey data.
There's also environmental data. There's water
you guys-
data.
Do you guys have like a data dictionary or maybe like a user guide that you could send us that would help us, that we could review it before the demo?
Meet with the vendors and we can ask them for that, Anna.
Yeah.
So when I asked Shauna, when I asked what the role is, so I'm just trying to figure out, like, is Anna, is she like the temporary, project manager, and Shauna, you're our general ITSD contact? I'm just trying to figure out roles that way.
So I'm the application development bureau chief. And so I oversee all of the application development that is happening at DOH.
Okay.
And I look to see like number one, like what are we gonna do? Are we going to
Mhm.
get a third party again and work with a vendor so that we can build a system? Or is it cheaper to build it in-house? And if so, then what resources are we going to use? And so we have a few like kind of, I need to look at, first of all, I need to demo it to see what realm this would fit into. Like can we use like RedCap for this? Do we need to build like an entity framework that's .NET based? I need to look at
Okay.
what we're
Yeah.
dealing with here. So then
And
Anna's role, she's new. Anna's new to us. She comes from she came from the private sector. She was a project manager. She worked on the vaccination project that PhD just they finished the first phase. Now they're working on the second. And she is heading the maintenance and support team in my department. So
okay.
She's
Great.
terrific, and she has worked with multiple state agencies, leading different projects. So she's great. She's a great resource on our team.
Okay, and just for awareness, so essentially the NMIBIS, and Christopher couldn't come because he's at an equity conference, but Christopher Whiteside, he is the bureau chief for the Community and Health Systems Epidemiology Bureau, and that's where NMIBIS is housed technically. So there's a position that maintains IBIS, that supports IBIS. So there's actually a position there that was Rena Manning until she transferred within ERD to infectious disease. So we have a position there that supports NMIBIS. But then, and so that's like one of the instances of the IBIS platform. Stephanie.
Heidi,
Yeah.
before you continue, you said NMIBIS is housed where? What's the name of the?
Community and Health Systems Epidemiology Bureau, CHSEB.
Okay.
And so that's where it's housed with one FTE to support that. However, within the Environmental Health Epidemiology Bureau, EHEB, is so Shrikant Paladagu, he's the bureau chief. Stephanie McHaley is the program manager for environmental public health tracking. Environmental public health tracking is what's providing the funding what's provided the funding in the past for STG, as well as for the environmental public health tracking instance of IBIS. So the environmental public health tracking website, it's a separate website, but it's off the same IBIS platform. So it has a slightly different look and feel. And there's requirements under the environmental public health tracking program based on funding that's provided by the CDC. And so one thing which is probably going to prevent, using something like REDCap, is the fact that there are requirements to map the data at county level, and then sometimes as well as at census tract level, and then doing that on the fly as opposed to canned maps. So that's always been the most challenging aspect of the tracking instance, as well as the main NMIBIS instance. So that's just a little bit more background, and in terms of roles, I'm over CHSEB as well as EHEB, both of the bureaus. So that's why it kind of makes sense for me to coordinate some of this stuff. So I'll leave it there.
Great. That's good info. And I'm recording this session so I can go back and listen to
Sure.
what you've shared. It's a lot of info, but helpful.
Yeah, and I also just want to know, and I mean, we can always, email everybody in this group for now, but I also, sometimes there might be questions that are more specific to Anna and sometimes more specific to Shauna. So I just want to make sure I understand. And then I also see Mika. So Mika, I wanted to know if Mika was going to be playing a role in this too. I assume so, since he's on the meeting.
Yeah, Mika is on the M&S team, and Mika it does so many different things, testing of new applications, documentation, training. He's an amazing trainer. So, he usually he's involved in all of our projects in one form or fashion.
Okay,
So,
yeah, I mean, I'm most familiar with his role with respect to Dave and Vital Records, but that's good to know. So thanks and welcome, Mika.
Thanks, Heidi. So I had a question. I think Stephanie is the main contact currently in the program area for IBIS. Is that?
I would,
FTE
well,
also?
I would say Stephanie and Christopher Whiteside. We haven't gotten a replacement for Rena yet, so I would say both of them.
Okay, Christopher Whiteside as well. Okay, I'll just add that to our documentation for that application.
Okay.
Thank you.
Yeah.
So how many months are you guys doing a contract with
Data files?
Lois and
Till-
Paul. I don't
till
know what
the
their
e-
company's in.
Till the end of the calendar year next year.
So end of
Okay.
2024?
Yes.
Okay. And how many hours does that end up being, Stephanie?
Oh gosh, I calculated it. I can't remember. I'd have to get back to you on that, but it's not a whole lot.
Okay.
Well,
it's just to
and-
keep the lights on. It's just to keep the lights on, right?
Right.
I thought it was something like just under 600 hours, like 500 and some odd hours.
Yeah, because let me.
Because it was like $100 an hour, right? Something like that.
Right. It's $100 an hour. So, and then of course, taking out gross receipts.
maybe
I'd
it's
have
more
to
like-
get back to you on there.
Okay, but let's just say approximately 500 hours. And it's
Yeah.
mostly for, troubleshooting and for ensuring that we have data updated. So like Arian, for example, wanted to update her query and she was saying, hey, are we going to be able to do this? And yes,
Yep.
we want everybody to update their queries to make sure that the data are as updated as possible, because we don't want to have quote unquote old data in an IBIS and then update that data in the new system, whatever that may be.
Mm-hmm. Okay.
What's Lois and Paul's company's name?
It's called data files.
Data
With-
files.
With PH instead of F.
PH. Yeah, DATAPHILES. And they're
Okay.
working on getting their UEI, and they were working on getting in share. They were in share, but somehow it was inactive, or there was some kind of realignment they had to do.
Oh,
I
as a
think
vendor,
that-
you mean?
As a vendor, yeah.
Okay.
But that's,
Okay.
we're working on that.
How old
Okay.
is the system now currently?
10 years.
Yeah, I mean, I was thinking
Maybe not quite that long.
2000. Well, I was thinking like 2008 is what I was thinking. Is
But
that,
wasn't that was under UNM?
oh, that was still under EDAC?
Yeah, that was EDAC. I think they came online between 2013 and 2015. I want to say 2015. So maybe it's only 8 years.
Okay.
No, that's a long time, right? I mean,
Yeah, it's
in IT
very,
world, it's like ancient,
it's
right?
antiquated. It really is. And part of the problem is that updating the data it's all hand curated right now.
Mm.
And which is why Arian probably hasn't seen an update of her data in a long time. So
Right, and part of what we talked about, Sean, I don't know if you remember, we mentioned it briefly when we were on the meeting with Glidden, and Scott Moy was part of that discussion too, is to say, okay, how much can we facilitate this potentially through the data lake? Because if we already have some of these data sets, and if the query could pull through the system to the data lake, I'm sure I am not saying that correctly, but hopefully my idea is conveyed, then that may be more efficient as opposed to having to have abstracted data. So, here's the birth file, we're going to upload it to IBIS. Here's the death file, we're going to upload it to IBIS. So trying to incorporate efficiency into the data query system.
So is the vendor willing to give us the code and to maintain this? Are they willing to hand it over to us?
it's not, it's my understanding that it's not proprietary, but I can't really speak to that.
Well, and I get the sense, Stephanie, that it's not that straightforward,
No, I
because
don't think so.
my understanding is that, yeah, okay, there's code for the web page and there's certain codes, but it's actually like, I mean, I remember getting trained, and I probably forgot a lot of it, but getting trained for how would you do this on IBIS? And so it's the code. I think they would give you the code, but that's only going to get you so far.
Right. It's a very complex system, and it's, there's little nuances to it that make it really difficult to to work
Mhm.
with.
And the fact that it's SaaS based, right?
It is SaaS based, yes.
Okay.
So I think we need to coordinate a meeting with them so
Okay.
that we can do a demo. I need to look at, I need them to give us some information, like what type of database are they utilizing? How much data, if they have a data dictionary, and or a
So-
diagram.
So there's a lot of do you have access to the shared EPI drive?
No,
Okay, because there's in that drive there's a folder with a whole host of trainings, and a lot of that information might be there. I don't know how, I don't know if we can work with them without having a contract.
we're gonna need to, we're gonna need to get this data. So the problem, a lot of this is what resources do we put on this? And so that's why we need to establish funding. But to start this off, we can have a meeting with them and ask them specifically the questions that, we need in order to get this started. But I do need to bring in a developer at least part-time in order to build you guys a full-blown application. Unless we want to look at third-party vendors like you guys have been utilizing, and then you guys can work with somebody else like Respect to build you a system. But either way, you guys are gonna need to come up with money to build a system. And the fact that the contract has ended and you guys are looking now to replace it is a problem.
I've been working on this for 2 years, solid, trying to get a contract in place. I'm sorry. Yeah.
So we'll probably have to utilize some of those hours to meet with the vendor to, to get the information that we're needing.
I can tell
So
you,
let's,
Shauna, it is a SQL database and we do have an architecture diagram.
I thought it was
good.
SaaS based.
well,
It's,
SAS
Yeah.
is the data.
it's complicated. SAS is integrated into it and, but there is data in the SQL database. And like I said, I have an architecture diagram that's pretty detailed. That the vendor put together, that Paul and or Lois put together, from STG. So,
Can you send?
yeah, I can send.
Okay, and Stephanie, I think Stephanie said this.
Yeah.
Can we get access to that EPI shared drive that you
Sure.
mentioned?
Okay. Yeah, should I just put in a help desk ticket and
Yeah.
get you access to it? It's our shared drive, so I don't see any problem with. I will absolutely do that.
Okay, that'd be
And
really helpful then. I can sift
just
through
for-
stuff.
just for perspective on this, it's like, hearing Stephanie's frustration about this it's been super hard to get contracts in place, as I think everybody knows, in the past year or two. And then also just there's been so many other things and fires that have to be put out. And then trying to have some time and bandwidth for the agency as a whole to focus on IBIS just hasn't been there. So Stephanie's been trying to do it. And so is Rena. And so it's super tricky. So I just want to acknowledge that, Stephanie. I know that you've been trying to do your best to get this forward, and hopefully, it's later than we wanted it to be, but this is how things have happened in post-pandemic land. So it is what it is.
Well,
My
now
apologies.
it's
No.
gotten to us, so that's good. We got the PSR. We're talking, so and getting access to some of those artifacts will be helpful. And we can start to kind of set ourselves up while all the funding gets ironed out. And this is just a kind of I think the system has a really cool name. I'm into Egyptian ancient history, so I'll take care of you guys.
Well, in this case, it's actually a bird, but obviously it can also be the Egyptian interpretation.
Yeah, exactly. So you made it to our offices, and so we can start looking through all the artifacts. And do you guys want me to help you set up a demo?
I think we could do that.
Okay.
What do you want to see with the demo? You want Lois and Paul to demonstrate how it works, or?
Yeah, just so we can see what the screens look like, and we can ask
Oh, sure.
questions, and we can ask them, like, where's all the data coming from, and some of
Gotcha.
it might be repeat that you've already shared with us, but
Right.
who's using it, how do they use it, are there different types of accounts, we'll be asking lots and lots of questions,
Okay.
but just seeing it is half the battle, right?
Right.
And
Right.
And
knowing what kind of data's in there.
And at the very least, Stephanie, I think it needs to highlight the different levels of data analysis that are needed. So, you've got the CAN indicator reports. Maybe
Yeah.
we would do something the same, like, or slightly different, I don't know. But then the canned indicator reports, the query, but also, like, what's the finest geographic display,
Mhm.
you know. So I think just to kind of highlight the breadth of what it does right now, and
Okay.
then yeah.
Okay. I can contact Lois, and she's not in today.
Okay.
That's my
That's okay.
understanding, but I can reach her tomorrow and see.
Okay.
And so
And if
we can
once
set
you
something
guys
up.
send us the invite, is it okay if we forward it to other folks that might be involved
Absolutely.
in the project?
Sure.
Yeah. Okay.
in the meantime, what I'm going to start to do is, and I'll bring it up at the management team meeting on Thursday, our ERD management team meeting. So my action item is going to be to start talking about convening a meeting to start talking about supporting funding for the new platform, and why we're doing this, because Arian made me realize, okay, it's clear in my head, but she didn't have the background, so I can put the background together and then say, this is why we need funding, and then figure out who all we need to invite, and then I can coordinate a meeting on that.
Thank you, Heidi.
Sounds good.
Appreciate it.
And I guess Heidi, Shauna, of course, needs to be invited, and I guess I should be invited too.
Sure.
Okay. Alrighty.
Shauna, I
So
have a question. What kind of funding level are we going to need? I mean, it sounds like a huge project.
yeah, yep, this is a pretty big application from what it sounds like. I mean, we definitely need to look at it, but I mean, we just built an application for the vaccine immunization program, and that was halfway built already, and it took a good year to collect all the requirements and then gather a team. In that project, I got $1 million to hire app developers and build an application. So,
But is that something that's from scratch, that didn't exist before? You didn't have any of the data collected before, none of that?
no, this is an application that we did actually have
Okay.
standing already, and we just enhanced it. So that's like just to give you guys a rough understanding of how um detailed, I guess, it would be for us to build an application. But I mean, just depending on what we're looking at, I need to see it because
Okay.
RedCap has evolved a lot, and there is GIS now that we can do more advanced plugins to, and so that might work. And if that works, then that would be a great solution at little cost. But to bring in a developer for a year, it's about $220,000. So, and we need a project manager. So, those are the two necessary individual contracts that I would need. But the other thing that I'm thinking of is, are they going to be, if you guys don't have a contract in place, are they gonna give you support with no contracts?
No,
So do you guys have a contract with them right now?
no.
What was
Okay.
the 500 hours left statement?
No,
No,
that's,
that would
that's
be-
the, go
Mhm.
ahead.
That would be the contract that we're trying to get in place right now. The 5,900, 59,000.
Oh,
So
Contract.
STG, which is the vendor that's been supporting NMIBIS,
hmm
that contract, we did have a contract with them, but then when did it end, Stephanie?
Well, sometime in 22, I think.
Okay, so like when we've been meeting with them, they've just been kind of helping us out of the kindness of their heart.
Pretty much.
Oh my
wow.
Okay, well, we're in a procurement violation because we're getting services that we're not paying for. So
No, actually, it's not a
No.
violation. There was a thing called banked hours that they utilized
Yeah.
at that time before the contract ended. So they're billing us from that banked hours or helping us with those banked hours.
Right, so we had already paid, it was part of the contract, and so they're using those banked hours, so it shouldn't be a procurement violation as long as it's within the term of the contract. So the term of the contract ended when, or is it still?
No, the term of the contract ended in 20. Oh my gosh.
I think like June of this year, probably.
Oh, was this year?
The term,
Oh,
yeah.
I don't know
the
why I
term
thought
of
it
the
was
contract
last year.
ended June of this year because that's
Oh,
when we had those banked hours to be used up by.
Right, so you're not,
Okay.
there's no more work right now, and there's no
Yeah.
more invoices, is that correct?
Yeah.
Yes.
Okay, all right.
okay.
so we need some information from the vendor. We
Yep.
need to talk with them. I don't know how we're gonna pay them. And right after we get off this call, if you can add me to the email so I can find out what's going on with the contract, because we're gonna have to find out if we can even put a contract in place at this point. So, and these contracts take, even if we had a statewide purchase agreement active right now, these contracts typically take at least like the shortest time is a month. So, yeah, I mean, we're really behind.
Yep, that's right, that is a correct statement. We can only do what we
Okay.
can do, so. So Sri will do that, add you, Shauna, and then I'm also making Laura Parhon. We're gonna bring it up the management team meeting, and so we're, and then Laura is already in the loop, but I will emphasize it again in case we need to do anything else, and of course Glidden is aware too, so.
Okay. So guys, to keep us all on track, I'm going to create what I call a CRADE log for this, quote unquote project. It's not official yet, but so that we all stay on track. And so I'll give you access to that log, and I'll send reminders just so that we can stay on track. Okay.
Sounds good.
Sounds good.
Okie
You find out from the vendor if we can take over the application, if they're willing to give us the code. If they're not willing to give us the code, then at least we need to get the data dictionary from them. Because the
Okay.
data for sure is ours, but
Right.
if we can see the code around it, then we could potentially figure it out.
Okay. Could I get an email to that effect so I can forward
Mhm.
it to them? Thank you. I would
Yeah.
appreciate that.
Okay, I'll send
So I'm
it.
not asking for the wrong thing.
Okay, I'll send it to you, Stephanie.
Awesome. Thank you so much, Anna. Appreciate it.
Okay. Okie dokie. It sounds like we've covered a lot of territory. Is there anything else super material that we should know about before we end the call?
I don't think so. I mean, I'm just wondering how I can get this stopgap $59,000 contract in place. That's
Yeah, I
I'm
think,
very unclear on how to move it forward.
yeah, so I think part of moving it forward is the fact that Sheree or you is gonna add Shauna and Anna onto the email that was sent to Joseph and Glidden.
Okay.
To say, hey, we discussed this today, and they're not on the statewide price agreement, and so how can we expedite this?
Okay. All right. Thank you.
Great. Okay. Well, thank you guys for meeting with us. I apologize about all my audio issues at the beginning. Looks like we've gone over by 18 minutes. So thanks for your time. And we will do everything we can to make this happen.
Thank you very much.
Thanks,
Okay.
appreciate it.
Have a
you.
great afternoon, everyone.
Bye-bye.
And Mika, can you guys
Yep.
stay on?
Yeah.
Yep.
Okay. Anna, do you want to stop recording?
Yeah.